Hi everyone, I'm Mary. I am going to be the narrator for this scenario. Right now I'm just going to give you a little brief outline of what our scenario is all about. We have Darlene. Darlene is in hospital, set to have a hysterectomy. With her is her partner Sally. Sally was diagnosed with schizophrenia in her teenage years, and she has been well managed on medication since that time. But recently she's taken herself off of the medication because she says it makes her feel foggy. So some other ways that antipsychotic medication can make a person feel is drowsy, dizzy, they can have blurry vision, they can have dry mouth, their heart can race, they can be sensitive to the sun, they can develop a skin rash. If they're female, they can have menstrual problems. It can give you sexual problems, and you can have enlarged breasts, and that could be for a man or a woman. So the way that we did our scenario, we decided to do what not to do, and then what you should do. So the first little bit is what not to do. So it's wrong. We know it's wrong. And then the second portion of it is going to be how we would actually handle it in the professional world. And I just wanted to acknowledge that we got this idea from Lexi and Kenzie. That's how they did their dementia project last year, well, in the spring. So I just wanted to acknowledge that. So there's a few things that I think that we should know about schizophrenia before we start. This won't take long. With a psychotic disorder, there are 5 key features: delusions, hallucinations, disorganized thinking, abnormal motor behavior, and negative symptoms. So negative symptoms are like things that should be there but are not. So you and I have good decision making. We have the ability to process information. When someone with schizophrenia, those things are removed. They don't have those things anymore. And usually the age of onset is typically between 15 and 25 for a male and 25 to 35 for a female. So Sally was actually diagnosed younger than normal, but that's not out of the question. So what causes schizophrenia? It can be a psychological or an environmental factor. It could be something that happened prenatally. It could be a psychological stressor, or it could be an environmental stressor. And the other thing that is important to know is there's 3 phases. There's acute, stabilization, and maintenance. So the acute phase is when all of those symptoms are exacerbated. They're out, they're raw, they're right at the edge. Stabilization is when it starts to get a little more even. And maintenance is when you're back to baseline. You're on your way back, or you are back at baseline. So Sally was in the maintenance phase, but since she stopped taking her medication, she has looped back to the acute phase. So that is the rundown of our information about our scenario. I hope you enjoy it. Thanks so much. Hi friends, so today we have a scenario with Darlene. Darlene has been admitted to the hospital for a hysterectomy, and she's waiting to go to the OR. Her partner, Sally, is at the bedside. The nurse is going to come in to administer some pre-op medication. Sally was diagnosed with schizophrenia when she was young, and she's been off her meds because the meds make her feel foggy. So let's see how this goes. Ready?
Good morning.
Hi.
Hello. You
Hi.
must be Darlene, and this must be Sally.
Yes.
And I'm your nurse, Danielle. So today you're getting a hysterectomy.
Yep.
So this is your medication for your pre-op. I'm just going to administer that to you now.
You can't give her that! They told me you were gonna poison her. They told me you would. Don't give her that.
Stop. I need to do my job. Don't yell at me.
Oh my goodness, what is Nurse Danielle doing? I can't believe that she responded that way to a patient's family member.
What's going on in here? This crazy person thinks I'm trying to kill her partner.
Don't kill me! Don't kill me! Don't kill me! No, Jesus Christ!
I think we need to call
Leo,
the
they're
police.
coming. I know, Leo. They're coming from me. They're coming from them. They're coming from them. Yeah, they're coming from me. They're coming from me.
The police? Oh my God, Nurse Danielle, what are you doing?
Sit down. You need to sit down. Listen.
No, they're here. They're here. I don't see them. They're here. There's no one here. They're there. I see them. They're right there. They're right there.
Oh my God, what is going on?
Arlene needs her medication for her surgery, whether you like it or not. Security. Come on.
Wow. Okay, so clearly the approach by the nurses was way too aggressive. They were verbally aggressive. They were physically aggressive with Sally. It just escalated way too fast. Not to mention, Darlene was completely lost. The whole purpose of this thing was Darlene was supposed to get pre-op medication for her OR. She didn't get it. Also, what was up with Nurse Danielle's scrub top? That is not appropriate for an adult center. And it clearly triggered Sally. So that's not a good situation at all either. Not a good scene. Not a good scene at all.
Hello, good morning. Hi, do you mind if I turn the light on?
Yeah, go ahead.
Perfect. Thanks so much. So I'm Danielle. I'm going to be your nurse today. You must be Darlene? Yeah. Do you mind if I just check your bracelet?
Go ahead.
Perfect. Thank you so much. And is this Sally, your partner?
Yes.
Perfect. So today we're going to be doing a hysterectomy for you. And I just have your pre-op medication. Would we be able to administer that?
Yeah.
Awesome. Thanks.
You can't give her that. You're going to kill her. They told me you would.
Sally, why do you feel that way? Why do you feel like I'm going to poison your partner? Do you think we could sit down and talk about it? I need you to tell me more about why you're feeling this way.
They're there. They're in my head. They're telling me. The voice told me you're gonna poison Darlene. You can't give her that. Don't give her that.
Who's
You're
telling
gonna
you?
poison her. They're telling me. The aliens. Can't you hear them? They're telling me you're gonna poison Darlene.
Do you recognize the
Poison you,
voices?
honey. Excuse me. You're gonna
So in this scenario, you can see that Nurse Danielle approached Sally in a much better way. She was much more therapeutic. She was much calmer. She asked Sally what was going on. She wanted to know what voices she was hearing. Much better, much better.
Sally. Oh, hi, Callie. Hi there. Do you need anything? I think we're okay. I know you heard the commotion. Sally, this is my coworker, Callie. She just heard the commotion, so she came in to help us.
The aliens. They're coming.
Darlene, have you seen this before? Is this normal behavior for Sally?
Sally was diagnosed with paranoid schizophrenia when she was younger. As long as we've been together, she's been on medication, but she stopped taking it about a week ago, and I've never seen it this bad.
I don't need those meds. I'm telling you, you're trying to kill me. I'm just trying to save you.
Darlene, what have you tried in the past when Sally is in this type of state?
It's never been this bad before, but she usually responds really well to a dark, quiet room. That usually seems to help her desensitize.
Okay, yeah. Did you want to turn the lights off, Callie?
Yeah, we'll see how that works. I'm gonna turn the lights off, Sally, okay?
Sally, did you want to try some deep breathing with me? Maybe we can breathe in through our nose and out through our mouth. Perfect. And once more. Perfect.
So Sally has calmed down because Danielle and Callie have taken the time. They've done some deep breathing with her. They've talked therapeutically with her. They've been very, very calm. They've listened to her. They've tried to figure out where all of this is coming from. So at this point, Sally has de-escalated.
Okay, Sally, did you want to do another deep breath? Maybe in through the nose and out through the mouth.
All right, Sally, would you feel comfortable going for a walk?
Yeah, I think so. I can go for a walk.
Okay, why don't you
Will
come
you
with
be
me?
alright?
Sally will be alright. You go have a walk.
Okay.
I'll see you when you get back.
Go for a walk.
Yep.
So Danielle and Callie have de-escalated the situation. Callie has taken Sally for a walk. And now Danielle is going to give the medication that she initially came into the room for. She's also going to talk to Darlene about her own mental health, what her supports are like. And, you know, she was going to try and find out some more information about Sally. Maybe Danielle will be able to give her some resources that she can use outside of the hospital after surgery is over.
Okay, Darlene, now that Sally has gone for a walk with Callie, do you want to administer your medication for your hysterectomy?
Yes, please.
Perfect. I have it right here, so I'm just going to check your IV site and then administer through that. Seems to be intact. All right, take a deep breath. Perfect. All right, so we have a few minutes to wait before your surgery. Did you want to just talk about maybe the situation that just happened?
Sure.
Okay, perfect. So what are your supports like at home?
It's pretty much just Sally. We've kind of just been the two of us together for a long time. My parents aren't really in the picture anymore. Didn't really like the whole gay thing. So yeah, it's just been us, and that's kind of it.
Darlene, earlier in the appointment, you had mentioned that this is normal behavior for Sally.
Yeah, as of recently, since it has been. It wasn't always.
Okay, is she on medication?
No, she stopped taking it. But actually, now that you say it, I think I have it with me in my bag.
Oh, okay. Sorry.
Yeah, honestly, she's had it under control ever since I've known her. And this is the first time I've ever seen her get this bad. Here, that's that.
Oh, great, perfect. Another thing, Darlene, I have some external resources. If you wanted some more information on that, I brought in a brochure.
Yeah, actually, that'd be awesome.
There you go.
Thank you.
You're welcome.
So while Darlene and Danielle are speaking, Sally and Callie are taking a walk in the hall. This is a great opportunity where Callie is going to take time to explain to Sally what's going on with Darlene.
So, Sally, you and Darlene are here at the hospital today because she's getting ready to have a hysterectomy, right? And so, for Darlene's medical safety, that's something that she needs in order for her body to heal. And it's very important that she needs that surgery. Do you agree?
I think they understand.
Okay. And so it's very important for the nurses and the doctors to get her prepared for that surgery so that she can come out of it with the best outcome. And in order to do that, she needs to have a little bit of vegetation.
You're not gonna hurt Darlene.
No, that's not what we
You
want.
won't kill Darlene. No, kill her.
Of course not. And this information I have here is about the medication that she's going to be getting before her surgery.
Okay.
And it tells you everything that you need to know about what the medication is, what it does for Darlene, and how it keeps her safe. Because if she doesn't have this medication, it's going to make the outcome of her surgery not go as well. And that's not what we want, right?
Save Darlene.
Exactly.
Save Darlene.
Hey, they're gonna save you.
So, Sally and I had a chat just about everything that's going to happen in regards to Darlene's surgery and the medications that she's going to be taking, and how important it is that Darlene takes these medications. And so, Sally, do you think you could explain to me what the medication is that Darlene's going to be taking and why it's important for her to take it?
Medication, good. Save Darlene.
Okay, so Sally, now that you have an understanding of how important it is for Darlene to take the medication, Darlene also was able to find your medication. Would you mind taking that? And Darlene, now that we're ready for your surgery, did you want to come with me?
Yeah, sure.
Perfect.
So as you can see, the second scenario was much more therapeutic than the first one. It was, it was good for Darlene, it was good for Sally, and honestly, it was good for Callie and Danielle because neither one of them got beat up. Hi everyone, thank you for watching. I'm Mary, I was the narrator, and this...
Danielle, I played the nurse.
I'm Ava. I played Sally, living with schizophrenia.
I'm Emily. I played the partner Darlene.
I'm Callie. I was the other nurse.
I hope you enjoyed our little scenario and you learned something. If you have any questions, you can certainly message us. Thanks so much.